All right, today we're jumping into a story that could literally change the future of medicine for more than 1 billion people. We're talking about India's massive plan to bring artificial intelligence into its entire healthcare system. So yeah, let's get right into it. And that's really the big question, isn't it? This isn't some far-off science fiction dream. This is something India is actively building right now. The scale is just mind-boggling, and the potential impact, well, it's nothing short of revolutionary. So what kicked all this off? Well, the big news is that India's government has just officially dropped a national blueprint for putting AI into healthcare. And let's be clear, this isn't just some idea they're floating around. This is a full-blown strategic mission. Okay, but what is this blueprint exactly? Let's break down this roadmap and figure out what it's actually saying about the future of medicine in India. So when you boil it down, the blueprint is basically a guidebook. It's a strategic plan to make sure that as all this AI tech gets developed and rolled out, it's done in a way that's safe, that works, and that actually helps everybody. You can think of it as the constitution for this whole new era. And this is so important. The health minister himself said the goal is to be patient-centric. This isn't just about cool new tech for the sake of tech. The entire focus, the whole point of this is the patient. It's about using AI to build the system that responds better to each and every person. So, how are they going to pull off this patient-focused vision? Well, the blueprint is actually built on a few key pillars. These are meant to tackle the biggest challenges head-on. Okay, so check it out. The whole thing is built on these 4 pillars. First, you've got to have ethical guidelines. Setting the rules of the road for this powerful tech. That leads right into the second part, building secure data systems. Because let's face it, AI is nothing without good data. Then you need to fuel research and development to get those new ideas flowing. And finally, none of it matters if you don't train people, from doctors to data scientists, who can actually use these new tools. It's a really well thought out approach. Now, a plan is one thing, right? But how do you actually put it into action? Well, this is where a brand new and, frankly, fascinating platform comes into the picture. Here's a problem that most of us probably wouldn't even think about. You can't just grab an AI model that was built in the US or Europe and expect it to work perfectly in India. The genetics are different, the environmental factors are different, the data is different. To be effective, the AI has to be trained on local Indian data. And so here's the brilliant solution. India is building its very own secure platform where these AI tools can be properly tested and validated using real but anonymized Indian health data. This makes sure that the tools are actually fine-tuned for the people they're supposed to help. And that platform has a name, AI Sanrakina. The best way to think about it is like a national quality control checkpoint. It's a gatekeeper. Before any AI algorithm gets anywhere near a real patient, it has to go through this platform to prove that it's safe, that it's reliable, and that it actually works for the Indian population. I absolutely love this analogy. It's just like a secure driving range, but for AI. Developers can bring their new inventions here, they can test them out in a totally safe and controlled environment, and they can work out all the kinks without putting any actual patients at risk. It's a sandbox for medical breakthroughs. So we've got the blueprint, we've got the platform. Okay, great. But what happens next? What could all this really mean for the average person living in India? I mean, just think about the possibilities here. We're talking about AI helping doctors diagnose diseases faster and with way more accuracy. We're talking about predicting disease outbreaks before they spiral out of control. It could even lead to treatment plans that are personalized just for you, or help bring expert medical advice to people in the most remote areas. Ultimately, it's all about making healthcare better, cheaper, and easier to access for everyone. And you always have to come back to this number, to the sheer scale of it all. This isn't some small pilot program. It's a national strategy. And the goal is to transform the lives and the health of 1.4 billion people. The ambition here is just, wow. So all of this leads to one final really big question. By building its own framework, its own validation platform, is India setting itself up to become the world leader in AI healthcare? Only time will tell, but it sure looks like they're laying the foundation for something extraordinary.